Hi, my name is Courtney Santiago, and my expected graduation date is May of 2021. How I define trauma informed social work practice is recognizing that tragic events and situations will change the way the brain processes information and make choices and decisions. The trauma that affects individuals seeking services will affect their daily life and all their decisions. Trauma can cause individuals to fear change and influence decisions for the rest of their lives. Often, trauma will stop individuals from moving forward and progressing in their therapy or case plans. For instance, if someone is a victim of domestic violence, that trauma may affect the individual, and it actually will affect their family if they've been viewing that domestic violence and been in the same room and witnessed it. So it will have to, that type of trauma will have to have specific counseling geared towards the trauma that they've witnessed. So, another situation, how trauma affects people. Someone who had trauma in their background, they might self-medicate with and have an issue with substance abuse because they're trying to self-medicate to get through whatever trauma they experienced. So when they go into therapy, they have to almost relive the trauma again to move past, to learn how to cope better with it. On a scale of 1 to 5, I give myself a 3 on my understanding. Excuse me. I've taken trauma-informed training in the past, and currently I work with families and children that experience trauma. And I've also worked with mental health in the past and worked with individuals who have experienced trauma in their life. The skills and goals I currently use in trauma-informed care is that I listen to the client, I let them explain their story and their background, I treat them with respect. I often will repeat what people say so they know that I hear them and I understand what they're telling me. I don't pass judgment when they tell me about things that occurred in their home. I make sure their children that are there, I make sure kids know that I'm going to, make sure the environment's safe for them and let them know that they are going to be safe and to see me in more of a positive light. My strengths is that I have a basic understanding of how trauma affects the brain and individuals and families and children and the body. So I would like to learn some better skills on treatment and how to help those affected by trauma, because there's situations that are different, and so how someone might view their trauma, someone else will view it in a different way, and so I'd like to know exactly how to help an individual who may have experienced trauma as a child, to help them be able to make better decisions now that they're an adult. And so I'm looking at any type of treatment options that would help our clients and the clients that I work with. So and that's it. Okay, thank you.